Okay. I think we'll go ahead and get started. So as people come in, I might be checking some other people in, but let's go ahead and get started. Okay, so for this, I'm going to go ahead and share my screen with you guys because I just want to go over some of what we're talking about. So first of all, it's kind of nice to know who you're talking to, right? So I'm going to tell you a little bit about myself. Before I became a physical therapist, I was a yoga teacher. And then I studied a little bit of integrative medicine, Chinese medicine, and so I've always had a passion for seeing the body as a whole, right? Especially when it comes to pain and stress. And so we're going to talk about those really interesting interconnections today from a physical therapy perspective, also informed by yoga. So I do see an orthopedic caseload, and I also treat pelvic health. And I'm going to talk to you about how those are really interconnected. So a lot of times we're seeing people for back and hip pain, and there's also some pelvic pain or pelvic organ issues that come along with that. Things like urinary leaking or pelvic pain or prolapse. And so I'm going to just briefly touch on those things and hopefully have some time at the end for questions. And then just so you know, after this workshop, you'll get an opportunity to have a free consult. So you can come in, you can see us, you can ask those questions because truly everybody is unique, and what I'm presenting today and sharing with you is really general. But it's always important to get that one-on-one perspective, okay? And as far as a little bit about what I do in the clinic, I do treat pelvic health. I have a level 1 certification. I also do dry needling. I like to blend a little bit of yoga into what I do for physical therapy, and I also do blood flow restriction. Okay, so let's kind of get started here. There we go. Okay, so we're going to be talking about managing pain with the mind-body approach. And so the first part of this workshop, I was going to tell you about the connection between the low back, hip, and pelvic floor. And then we're going to also learn about that stress pain cycle that I see so much in my patients, and that's why I wanted to start to share this with you guys. The pictures here I thought were really emblematic of what yoga can be. It doesn't have to just be what you see in these young, healthy, athletic types, right? So I love seeing some of these practitioners here, like over on the left side of your screen, women who are finding strength and flexibility in their body no matter what. Okay, and then in the middle, that picture I think is really fun. He's balancing on top of her in this super flexible pose. And actually the woman on the bottom is Jonda Scaravelli, and she started yoga when she was in her 60s, I believe, and made some incredible gains in flexibility and just stress relief. So I think that shows you can start at any age. There's really not a lot of barriers. And then the guy balancing on top of her is BKS Iyengar, who is from India and was very well known for helping bring yoga to us over here in the West. Okay, and so the reason my workshop is talking about a lot of different aspects today is because of my background when I started doing yoga research, and I started to notice some interesting findings. So I'm just going to tell you about those interesting findings that made me think differently about how I practice physical therapy. So a while back, me and my colleague were researching yoga and its effect on diabetes and range of motion to the joints, but also blood sugar regulation, body mass index, and I understood why it would affect joint health, right? We're moving. Movement we know is good for the body, right? So they found that back pain can be reduced in the short and long-term follow-up with yoga-based exercises in a number of studies. And that's intuitive, right? But what's even more interesting is that back pain disability, like how much your back pain is limiting your day-to-day, your ability to sit, stand, move, walk, that was also reduced with the yoga-based intervention. These interventions generally are 8 to 12 weeks, so that's kind of a commitment, right? And they're also finding that your flexibility in your spine were improving with yoga. And even more interesting, they were finding reduced cortisol levels in perception of stress, specifically in patients with low back pain when they started practicing yoga for that 6 to 12 week interval. And that's really interesting because cortisol is one of those stress chemicals that can really wreak havoc on lots of parts of our body and our systems. And even more interesting, some of the research on yoga-based interventions for back pain even documented a reduction in pain medication usage. So all of those are just really interesting and powerful. What I didn't understand was how it was impacting your blood sugar, right? So we know diabetes is a chronic problem. We know weight gain is a chronic problem in our society. And so the research with yoga was coming out to show that it was reducing your blood glucose fasting levels. And some of you may be familiar with the hemoglobin A1C, which is just a marker of chronically high blood sugar in your body over time. And so what we were finding when we were doing our research was that, there's a lot of variation in the studies, and we did a systematic review where we were pooling data from all those different studies, and we found that definitely fasting blood glucose improved. So that's like a short-term measure. But in the long term, we saw some studies showed that yoga was effective, some studies maybe not. So we're not quite sure, we're still investigating that. But it's also improving your body mass index and helping with your lipid profile. So I say but in the participants in the studies that they did. So those were all really powerful. But the reason I couldn't really understand that as a physical therapist was that yoga is generally a really light activity. So I'm trying to change my screen. Sorry, guys. I think it's frozen here. There we go. So the problem was that how can yoga be impacting your blood sugar, your body mass, all of those things when we sort of know that you have to have more vigorous intensity? So this chart right here is, I think, super helpful for anyone who's looking to improve their physical fitness. It's taking you through light and moderate and vigorous activities. So you see walking slowly, sitting at your computer, and things like that are just really light, probably not enough to get the changes in your body that you need. The moderate to vigorous are going to be your things like brisk walking, bicycle, badminton, and then more vigorous is, your heavy running and sport-related activities and working out at the gym. So it's commonly thought that you have to have more of that vigorous or moderate intensity to get the gains we're looking for. And yoga sort of fits in that light to moderate category. So there was something else going on with yoga that was helping improve people's well-being, besides just the fact that you're doing some rhythmic movement and moving your body. And so that just fits into, how much activity we need as adults for wellness, because we know lack of physical fitness can be a predictor of back pain and other muscle pain, but also the things like obesity and blood sugar dysregulation. So again, we need that moderate intensity activity for at least 150 minutes a week and some strengthening. And so a good way to know if you're hitting that is if you can do the talk test, right? So if you're having trouble actually getting your words out without pausing for breath, then you're in that vigorous category. And moderate is where you can talk, but you can't quite sing while you're doing the activity. And so with yoga, a lot of times we're maintaining that nice, quiet Zen space, so we're not talking. But does that mean that it's a vigorous intensity, right? Usually not, unless you're doing a fast-paced yoga class. We know that that's less than 50% of your max effort. So we know that it's not necessarily the same as what you see on the other end of your screen, where it's weightlifting and she's working at that high intensity, right? So again, traditionally we're looking at needing to get a little bit more of that higher intensity workload to get improvements in the areas I've discussed, with strength, muscle strength, important for back, hip pain, as well as important for glucose management and body weight management. Okay, so then why is yoga effective? And so it's kind of because we have this integrated system. So you can see it's not just your muscles, but it's also your nervous system and your endocrine system. These function really well together, and yoga seems to hit that really lovely integrative space. Okay, so let's talk a little bit about first the pain science and some of your back, hip, and pelvic conditions, since that's what I wanted to work on first. So how is it that these seemingly unrelated body parts can be connected? And I see it in the clinic all the time. They'll come in with back pain, hip pain, pelvis pain, and then we start to see it working as a unit. So you can probably see me on the upper left-hand side of your screen. You can see this model here. We're working with the pelvis, the low back, and these pelvic floor muscles. Okay, so that's going to just be the focus of today's work. So a key reason why we see some interconnections here is that trigger points are very common. They're basically stressed and injured muscles for a variety of reasons, and they start to send referral patterns along different parts of the body. So you can see sometimes you can have a muscle in your back or in your deep in your abdomen that start to refer to the hip. And then on the bottom too, there can be trigger points in the pelvic muscles as well that refer to the back and into the hip. So what we do in physical therapy is we try to isolate and identify those muscle groups and how you're moving that might be putting more stress and strain into those muscles to create those chronic trigger points, okay? So trigger points are just these areas that have chemical changes and they start to become very painful because of those chemical changes, and they don't really stretch or contract and work as well as they could. So sometimes dry needling and sometimes our exercises are what we do in combination to help with those trigger points. All right, let's go on to the next. Okay, the other reason we often see these patterns going together with the hip and the back and the pelvis is a concept that we call regional interdependence, right? Yoga is so good at this. It works on every part of the body, so it helps balance out some of those joints and muscles. So you'll see that seemingly unrelated body parts can contribute to pain because they're connected biomechanically. And this is just an example. You can see that if there's something going on in the knee or the foot or the back, it starts to create problems or pain down to the hip, to the knee, or up to the back, where, and depending on where you were injured. And we see this a lot because pain will alter your movement, and if you've had an injury like an ankle or a knee problem or something like that, it may start to affect some other areas. And so what we do in physical therapy and with yoga is we start to improve some of that muscle balance again for you. Okay, and then the other key concept that I think is really important when you're trying to heal and trying to improve your pain is to understand that we need both flexibility and strength. Yoga is really well known for flexibility and maybe not always strength. And so this joint by joint approach is a super simple way for you to understand how to work with your joints. So you can see on one end of the screen, there's mobile joints. So like your hip and your ankle and your neck need to be very mobile. Whereas your lower back and your knees need to be very stable to support a healthy, kind of non-painful movement throughout your life. So I think with yoga, the biggest thing is how much flexibility should you have, and when do you start to learn how to stabilize versus just stretch? Okay, and everybody's different here. But what's interesting is we know that if you have a difference in your hip range of motion from side to side, that can lead more to back problems, or what we call sacroiliac joint problems. And even after surgery, sometimes if someone has a disc replacement or a back surgery, they might start to get some SI joint or hip problems too, because again, as you start to change those joint motions, other parts of the body start to talk. And we also know that as some areas that should be mobile get stiff, it starts to change how people move. So today with yoga, we'll kind of work through some of those and help you learn how to identify which parts of your body to focus on in different postures so that you feel that you're stretching in the right way and strengthening in the right way. Okay, so here's some great pictures. So which one of these do you want to be, right? So I just put some common examples up there and just like how much flexibility is enough, right? So as far as, some of the deeper flexible poses, like the ones in the middle, I would, at least as a physical therapist, I would say those are maybe a little too much. Not because, of course, some people, depending on what you're doing in life, some people, younger people or people who need to do dance, that might be functional for them. For most of us, we want to be more on the sides there, where you're seeing some gentle stretching and some um, controlled opening of the hips, of the back, rather than extreme motions, right? Um, and so we'll talk about that and we'll explore some of those. And so as far as yoga for the hip, there's not a ton of great research on does yoga help for hip pain. Except I will say that my colleague has done a study where she shows that patients with diabetes have improved their hip mobility and normalized their back pain safely without any complications with a gentle yoga program. So I think it's super doable. We just don't know if it's enough because there's a lot of things going on in the hip and usually it requires some strengthening too, not just flexibility. And so we're going to go over this pose today. It's called a triangle pose and revolve triangle pose. And I'll show you how to modify it, but we're just going to talk about how sometimes you can over twist or overstretch and then you're not really creating the type of stability and strength that you need. And these muscles here are just talking about some key muscle groups that support your hip and therefore support your back. Okay. So one of my favorite topics, the pelvic floor. So basically, what are these muscles and why should we care? So if you particularly are struggling with things like urinary leaking, pelvic pain, maybe you've had prolapse, maybe you've had surgery, or even just postpartum, things like constipation or even sexual pain, all start to fall into understanding this lovely region. Okay? And so just to orient you, these pelvic floor muscles are a layer of muscles that support the organs, and they're the ones that just are at the bottom of our pelvis. They help stabilize our back, and they also help regulate our urination and bowel movements. I call it the pelvic core, and so we're going to be working on that a little bit today with yoga. So the pelvic core is not just about those pelvic muscles, but it's about how you use your core, how you use your breath, and how you use your back muscles. Is that people with back pain tend to have less support in these muscle groups. And then we know from some research that working on the pelvic floor can also improve back pain and urinary symptoms, and I've seen that in my clinic a lot. And then another interesting finding is that chronic back pain, if you've had it for a while, also puts people at risk for stress urinary incontinence, so some of that urinary leaking. And a lot of people are surprised to know that there's a hip muscle that connects into your pelvic floor. So strengthening your hips can actually have an impact on your pelvic floor in a positive way. And so a study at San Diego State University found that just strengthening your hips for 12 weeks resulted in pelvic floor strength as well. So that's fantastic. And then briefly, we'll just talk about some facts about the pelvic floor because it often gets underappreciated in our world. And a lot of my patients will come to me and say, oh, gosh, I just wish someone would have told me about this sooner. I didn't even know. So here I am to tell you guys about it so you can maybe share with people in your life who might need it. But pelvic floor problems are really common. So the most recent estimate in 2016 was that surgical repair for pelvic organ prolapse was estimated to increase about 50% from 2010 to 2050. There's a couple things at play there. Some of it is weight gain because that does have a profound impact on the pelvic floor. And then in a population of women, sadly women are more at risk to pelvic floor problems, but in a population of women who are older than 40 years old, the prevalence of incontinence was 41%. That's almost half. And when they kind of took a snapshot across different women in different groups, they found that the prevalence of at least one pelvic floor problem was 23%. So it's pretty high. And then I think what's more unfortunate is that these problems are undertreated. So only 25% of symptomatic women ever sought care. So what you see in the orange is people who went to a subspecialty, people who actually went to a specialist. And then you have in the blue, of those women who sought care, which is only a quarter of them, they just had some level of care. And I can't remember what level, but it was like a basic level of care. So I think that the research in physical therapy for pelvic floor treatment is really powerful and profound, and so we know that using some of our tools, educating, biofeedback, other things we do in the office can reduce symptom severity by 30 to 75%. So that's huge in terms of having a better quality of life and maybe preventing or delaying surgery if needed. Okay. And this is just talking a little bit about the bladder. There's different kinds of incontinence, and when you come in, we talk about what kind that is, and oftentimes it's good to work with your OB/GYN or your urologist to kind of determine what kind that is before we start working. But from a muscle perspective, most people fall into a couple categories. So I have a hammock here because those pelvic muscles, again, they're at the bottom of our pelvis, and they form kind of a U shape at the base of our pelvis, and they can either be too droopy and too weak, or they're too tight and not relaxing, and both can cause some problems. So is yoga good for the pelvic floor? So here's my thoughts as a pelvic floor physical therapist and yoga instructor, is that sometimes yes and sometimes not. So with yoga, it's a low impact exercise, so I really love it for patients who want to get moving again, but maybe have some prolapse or maybe have some joint problems in the back and hip like we talked about. So it's a great place to start. Now, the deep breathing and the stretches are really great for people who have pelvic muscles that are just too tight, maybe have some trigger points and things like that. And I give a lot of yoga exercises to my patients who come in. So I'll talk about some of my favorites today. The deep squats and some of the hip openers in yoga can sometimes cause some more problems. So you just want to tread lightly, and that's why I'm going to be working with some blocks and some chairs today. And then I would just say the biggest thing with yoga is I see people lacking the hip strength that they need. I think there's something with yoga where it just misses some of the hip strengthening we need just because of the way that the yoga asanas or the yoga flow is created. Doesn't focus enough, I think, on the hips. Okay, but it does a great job for strengthening the back and the core and working on breath. Okay, so in yoga, what we're going to practice, we're going to come up on our interactive section right now, so we'll get moving a little bit, which is nice. So I'm just going to talk about in yoga. So for some of you, I know some of you on the screen today have practiced yoga for a while, so you may know about Mula Bandha. So the Mula Bandha is something in yoga that we call a root lock. And all it is a pelvic floor muscle contraction in a way. So you're seeing, I'm giving you some pictures here where you're seeing the bottom of the pelvis, those muscles, and the goal of this is to lift them up and in, which is a pelvic floor muscle contraction. Now, it's often done in more advanced yoga or breathing or meditation practices, but today I'm just going to say, why don't we all learn a little bit of that? We don't have to wait till we practice 10 years of yoga. And it's often in the yoga literature surprisingly associated with improved sexual energy. And that's no surprise because we do know that using those pelvic muscles and making sure they're functioning well has a role in sexual function. And so in Light on Yoga, which is the classic yoga text, it's one of our most famous ones that we follow, BKS Iyengar, he was the one who was balancing on her back in the beginning when I showed you those pictures. He recommended doing Mula Bandha or pelvic floor muscle contraction in standing poses, back bends, and inversions. He also said to do it in deep forward bends. That's where I might differ from him. I think that might be a little problematic. So today we're going to focus on a couple poses in yoga, standing pose, and some gentle back bends that I think no matter where you are, you can participate, and some modified inversions, okay? So let's get started with some movement. You want to come to standing. We're going to focus on just opening up some of the back and hip muscles, okay? I'm going to bring a chair over and a block so that whatever level you're at, you can try to participate in a way that honors your body but doesn't give you a lot of pain. If you have any limitations in your hip or your back, the chair is going to be a good bet. And if you already know you're pretty flexible, I'm still going to encourage the use of a block, just because, like I said earlier, you want to have some safe movement rather than overly flexible movement. Okay, so let's come to standing in Tadasana mountain pose. All right, so feet, I'm just having my feet together here, and we're going to start to slowly inhale as we lift those arms up overhead. And then exhale, float the arms down. Just like you're moving through water, nice and soft. Bend the knees, we call that rooting into the floor, and then lifting, straightening the knees to rise. Lengthen and stretch. Exhale, soften down. Good. Inhale, lift. And exhale, lower, soften. Good. You're going to lift your arms up and you're going to grab the left wrist and you're going to gently bend over to the side. So we're working on stretching the low back muscles, and then you're going to kind of hollow your body forward so you start to feel a stretch through the side body. And then coming back to center. Inhale, lift up. Grab that opposite wrist. Lift up towards the sky and then start to bend over to the side. We call this kind of like a side bend, half moon shape here. And just notice if one side feels different. Do you meet restriction on one side or do they both feel free? Inhale to lift, exhale to lower. And then start to round and come into a forward fold. You can stop halfway. If you have range and you feel good, you can come all the way down. Okay, you want to bend equally at your hips and your spine. Good. Inhale, come up. And exhale, fold. Inhale to rise. Good, so we're just getting rhythmic motion using some big body parts in order to gain some flexibility. We're going to come into a standing series. So I'm just going to put the chair in front of me. I'm going to start with the chair modification and I'm going to come into the block. So I'm going to go like level 1, level 2, level 3 for you guys, okay? So inhale, lifting up. Exhale, hands to your hips. And then I want you to do a little bit of a pelvic tilt. So you're rocking your pelvis forward and back, right? You just want to feel that motion. That's going to be important in our stability for our back. And then you're going to find that middle ground. Sometimes I tell people, imagine your pelvis is like a bucket of water. And you're pouring that water forward. And then you're pouring that water backwards. Then find the middle. Find where that water is balanced and level. And let's work from that position of stability today. As you step your right leg back, okay? So you're in this lunge, warrior 1, keeping your pelvis level. Good, press your feet firmly into the mat, and then inhale to rise, right? Finding that opening. And exhale, bow forward, arms come back. Feel a nice stretch, starting to tone your back muscles. And then inhale to rise. Okay. You're going to come forward. You can use the chair for support. And then we're going to work on twisting and opening to the side. Opening towards your left. And then coming back. So here's where I told you that picture where you need to have good hip stability. So you're going to make sure as you lower and twist you're not rotating your hips and letting that hip fall in. You want to try to keep those hips a little bit more straight and twist a little bit more from your mid-back. You're keeping your core strong as you reach up, and you're using that chair for support. Excellent. And coming back, twist to the other side, sort of a version of triangle, spinning through the back foot, opening up. And exhale, turn back to the center, hands to hips, stepping forward. Inhale to rise, and exhale to lower. Hands to hips, find that pelvic tuck and tilt, working in the middle. Step the left leg back, warrior one. Inhale, rise. Exhale, bow forward, float the arms back. Shoulders lift and squeeze. And inhale, coming back up. Exhale, hands to hip. You want to have that chair nearby. If you don't have the chair, we're using the block if you're ready for that. And then you're going to be twisting towards the right. So left hand comes down to the chair or block, and you open up. Trying to keep those hips steady, right? You'll notice one side wants to collapse or fall, generally. Good. Bring that opposite hand down, right hand to block or chair, and then open up, working on your mid, back, and chest. And coming back. Hands to hips, coming back up, bringing feet together. Okay, so that just got all of our major muscles moving. You should feel a little warmer now, let's hope. You're going to take your block or your towel, whatever you have with you, and we're going to practice the Mula Bandha, right? So the pelvic floor work, okay? So this is just a super easy way to start to get some muscle overflow into the pelvic floor. It's a more detailed thing, but we're just going to work on the beginning levels today. So you have that block between your legs, right above your knees. You're going to tilt your pelvis forward and back until you find that middle ground. And then you're going to gently squeeze the block. And do you feel how that sort of lifts your body up? You should feel a lift, okay? And then work on mountain pose. Let's lift our arms up overhead, holding that lift in the pelvic floor. And exhale. Slowly relax the thighs so you're not gripping as much. Do you feel some of that release? You should be able to feel a very small change in those pelvic muscles. Gently squeeze the block, lifting up, and then lowering, starting to slowly soften your grip on the block. Good. Okay, so you can let go of the block. That is the first way to feel those pelvic muscles work. We're going to use that concept, that feeling in the pelvis, for our standing pose balances, tree pose. Okay, so you're going to bring yourself onto the left leg, right toe on the mat for level 1, and you're just gently bringing your knee out to the side. Okay, tree pose. So biggest thing I see here in yoga is people forget to stabilize in their hips, and they start to let one side come out, right? Which is really great if you're, wanting to do a fun dance move or something like that. But when we're working on healing the body, we want to be strong. So you want to have your hands on your pelvis and notice if you feel that twist. And you have the screen in front of you too, so you can kind of watch, and then you want to try to level that out by squeezing those hip muscles. Okay? And then from here, lifting up, you can have arms overhead for a harder version, and you can have hands out to the side for a little easier version. If you're ready for balancing, you can take that toe above the ankle, making sure hips stay level and this hip is really active and strong. Okay? And then let's lower down. Good. The good thing about balancing poses is they automatically help train our pelvic floor. So let's see if you can feel that on this next side when we go into tree pose. See if you feel any of that lift that you felt with the block. So you're going to come onto the ball of the left toe. And then level out the hips if you noticed any difference. Be nice and tall in your body, and then let's float the arms up on the inhale. As we exhale, let's bring those palms into the heart for an Anjali Mudra. And if you're ready, lift that toe above the heel. Okay, finding that balance. If you don't feel those pelvic muscles turning on, imagine you're squeezing that block. Try to find that same feeling deep in the pelvis of lifting up and in. Good. Exhale, relax. Soften the knees, coming into a mini squat or a chair pose. Reaching those arms forward. Holding for a breath. And then hands back to Anjali Mudra to the heart. Step the right leg back. Good. Find that strength in the core and in the pelvis. Imagine your pelvis is in that middle ground, not tilted forward or too far back. That supports good hip and back alignment. Inhale to lift. Exhale, arms float back, lean your body forward. Chest lifts. Step forward. Opposite leg comes down towards the back of the mat, warrior one. Find that pelvis position. Deepen the pose, start to bend forward, lift the arms up, stretch and lift your arms out and up. Exhale, float the arms back, shoulders back, getting long, pressing that back heel down into the mat. Good. And then floating forward. Okay, we're going to come down into our back bend series. So you'll want your block as well. So in Light on Yoga, he advises to use your pelvic floor muscles in back bends. The reason from a physical therapy perspective is because that gives your spine stability. Back bends are a particularly challenging posture and have a potential to make you overuse or overstretch some of the back. And so I'm going to show you the ways I like to start working with back bends. Okay, so on your stomach, we're going to do our Cobra series. You're on your forearms, and you're just going to gently squeeze that block. Okay? I think some people are still getting ready, so let me wait till everyone's down on the floor. Okay, awesome. So we're in Cobra. All right, so Cobra is great for getting some more flexibility into your spine and your hips. We tend to be really tight in the front of our hips and in our back. So the way to work with Mula Bandha, or your pelvic floor, is to gently squeeze that block and tilt your pubic bone, the front of your pelvis, into the mat. Okay? And then soften. Feel the difference. Right? So you're going to gently squeeze that block, tilt your pelvis bone, the pubic bone, into the mat, and feel your belly scoop up a little bit off of the mat. And then relax, soften it, let go. So you should feel that difference between sort of a supported posture with your muscles and just giving into a flexible position. Okay? Take that block away, and let's try doing that without the block. So I want you to think about spinning your thighs in, picking the belly button a little off the mat, and stretching your body forward. And then relax, lower down. We're going to do locust pose with the arms and legs. So you're going to reach your arms forward and lift your arms and legs. So we're working the low back muscles here. It's a wonderful posture. And then lower down, exhale. We're going to lift opposite arm and opposite leg. Right arm up, left leg up. And then switch. Right arm, left arm. Good. Now see if you can find those pelvic muscles. We're going to do a couple here. So ready, let's go. Inhale to lift. Exhale to lower. Inhale. And exhale, hold. Good. Lower down. Lift getting nice and long rather than stretching up. Good. Okay. Gently press up onto all fours. If you have any knee symptoms, feel free to go up in a way that's more comfortable for you. We're going to work on another back bend. So if you have knee symptoms and it doesn't feel comfortable to be on your knees like this, you can still practice in standing, okay? We're just going to be doing a little gentle back bend, okay? So we're going to work on camel pose, Ustrasana. This is a really hard pose. A lot of people really struggle feeling like it is comfortable. And so the block and the use of your pelvic floor, I think, really changes the ability to feel comfortable here. So you're going to gently squeeze that block between your legs. Hands come to support the base of your spine. You're going to lift up and gently bend back. And then exhale, coming forward. Good. I'm just going to do a couple of those. Notice I'm not trying to touch my heels. I'm not trying to do anything too fancy. I just want to get a little opening through the front body, and I want to feel the pelvic floor supporting me. Okay? Hugging that block, and then gently looking up. Variations are to interlace your fingers behind your back and start to stretch your knuckles towards the ground. That's a little bit more advanced. You want to maintain the integrity of your pelvic floor as you're doing that. Okay, so that's one example. And then we're going to do an inversion, just down dog, and I'm going to show you a couple ways to do it, and that'll be probably our last yoga pose here. Okay, so we're going to start with the chair. And this one I like just because it helps decompress the spine. If you're sitting a lot, things like that, this feels really good. It's a good starting place, and it's very soothing. So you're going to have your elbows supported on the chair, feet hip-width distance apart, and you're just going to start to stretch your hips back and lengthen your spine so that you're nice and long, right? Not rounded, right? And you're not trying to lock your knees out so you're feeling it in your hamstring. You can soften your legs, and you're just focusing on opening up and decompressing the spine. Okay? And this is a posture that I love to do throughout the day, even if it's not in the yoga routine or before I get started with yoga. Now, for those of you who want to try down dog, you're welcome to do that. I just want you to pay attention to having your spine long. So a lot of times with down dog, people are stiff in the hamstrings and they're just rounding in your back. So if you want to try down dog, you're going to bend your knees and make sure your spine is long just like before. If you can straighten your knees and still keep your back long, then fantastic. You're probably a wonderful yogi. But for most of us, we might need to bend the knees, or we might need to keep our back feeling good. Excellent. So I'm seeing some lovely down dogs there. Okay. Good. All right, so let's go ahead and go back. We are almost done, and I want to save some time for questions, but I also want to go back a little bit into the blood sugar and pain, okay? So you can make your way back to the screen. I'm going to share my screen again with you guys. Alrighty. Awesome. Okay, so low back and stress. Oops. Sorry guys, I did it from the beginning. I meant to do it from, okay, there we go. So low back and stress, guys. So the power of yoga is that it's working on the whole body, the mind, the spirit, and the muscles. So this picture here has been wonderful work by people who study pain neuroscience education. And it shows that when we have some tissue injury, say we get injured in whatever way, it gets fed into our brain and it starts to create some chemical cascades, some stress chemicals. And that therefore affects a lot of mood, sleep, concentration, and then those chemicals in fact create this vicious cycle where they create more tiredness, fatigue, and soreness and deconditioning of your muscles. And so what's cool in the research is that a yoga-based intervention along with physical therapy is showing that it improves that stress response related to pain. Okay, so that's what I mentioned before. And so the reason I believe that yoga and exercise are effective after the things I've studied with physical therapy and yoga is that rhythmic, gentle aerobic exercises using large muscle groups for 15 to 30 minutes, 3 times a week of at least 10 weeks is always in the research showing some positive effects with back pain, anxiety, depression, and self-efficacy. All right. And the reason why is we think it's mostly through improved blood circulation and endorphins. Those are the chemicals the body naturally has to fight pain. And then aerobic fitness helps with your heart's ability to react to stress and has less inflammation in the body. Okay? So this is just a good image to remember that our body processes pain in a lot of ways. It's a complex thing. So in our brain, we have something called the limbic system. It's sort of our emotional processing center. And in mindfulness, yoga, and other techniques, they're finding that that limbic system is an area that gets sort of more activated. And so they're thinking that that's part of the reason it's reducing the stress response. So with chronic pain, like I said, it changes how we move. It sometimes causes more fear and apprehension of movement. And we know that depression, anxiety, and fear avoidance all make acute back pain more likely to turn into chronic back pain. So we want to stop that cycle early on. And I will say that as far as changing movement patterns and having less response or less room for activities is what I see a lot. And so with physical therapy, it's like helping you figure out which muscles and how to get started with activity so that you have more room for activity and not at risk for re-injury. Quickly about the blood sugar component, because I do think that's really interesting because we know with more adiposity, so if we gain weight, if there's obesity, we're getting this low-level inflammation in the body, and that's leading to less tissue repair. And hopefully this chart isn't too much. I love this chart. I think it's great, but I know not everybody's a chart person, so you're welcome to just listen in if you want. But all of that is feeding into some cholesterol, lipid, and blood sugar problems. Oops, sorry guys, let me go back. And that also leads to things like inflammatory tendons. So if you're getting a lot of pain, it could be like some tendons, as well as osteoporosis or osteoarthritis. And the biggest thing that means is just that we're losing function, we're losing activity. And we know from research that exercise is very helpful in this way. Obesity also leads to muscle loss. So that's what sarcopenia, it's a fancy word for muscle loss. So what I think is really powerful about exercise and yoga is that it's helping to safely integrate more muscle strengthening and movement in a way that isn't quite your max weightlifting yet, but it just prepares that tissue to be a little bit stronger and ready for the next phase. And I just wanted to show you this because a lot of people don't quite understand that actually with obesity and things like that, the fat gets deposited into the muscle. So that actually changes your muscle's ability to work well. All right, so that's what that fancy picture is all about. And then I mentioned before that obesity, this chart just shows how it's increasing in even children. And so it puts people at risk for back pain, pelvic floor dysfunction, inflammation, things like that. Okay, so let's talk about relaxation a little bit. So I'm going to go to this slide here because one of my favorite researchers was Dr. Herbert Benson, and he was operating in the 50s where he started looking at yoga. He was very interested. He was interested in the cardiac benefits that he was seeing with yoga practitioner, or he was interested in helping his patients who had cardiac problems. And he was looking at people who practice yoga and was like kind of sensing something was going on there. So He did a number of studies, and more people have done more studies about the relaxation response and its positive impacts on our blood pressure, our breathing rate, our heart rate, metabolism, and things like that. So when we're talking about relaxation, I think that's it's almost frustrating, right? When you're stressed and you're in pain, it's really frustrating when someone says, well, just relax, do something that helps you relax, because you can't. You've already ramped up that cycle, right? So it can sometimes feel like, oh, well, if I try meditation or I try this, it doesn't quite work. What's wrong with me? Well, all of those relaxation techniques are more of a technique. They're not a guaranteed response, right? So I'm going to talk to you about what we know and research has helped bring forth that relaxation response. So with the relaxation response, it's actually a physiological state. It's a rest and digest. It's a way for your body to repair. The threat response or the stress response is where you have metabolism changes, heart rate increases, increased blood pressure, cortisol levels, that stress hormone, everything is higher. And so the opposite is true in a relaxation state. So what Herbert Benson found is that you need 4 things to bring forth that relaxation response. So 4 simple things, right? So no matter what, if you like yoga or you don't like yoga, you don't necessarily have to do a yoga-based meditation. You just need to hit these 4 things in whatever it is you love to do. So first one is you need a quiet environment, right? You need a place that has few distractions and a place where you feel comfortable. For some people, that is a place of worship, or it's a yoga studio, or it's somewhere in nature. But you just need to have that setting for you, okay? And you're going to need a mental device, okay? So a mental device is really just to shift your focus from worrying, troubling thoughts, or something happening on the outside. So it shifts your mind from this logical, externally oriented place. It can be a sound, it can be a word, or a phrase. Again, in yoga, a lot of times chants are used. A lot of people have heard Om and things like that. In prayer, we know that is a powerful way as well. So anything that speaks to you is a good place to start. And then the third one is a passive attitude. And guys, this is so important because a lot of times people come into meditation or relaxation with sort of this aggressive mindset of like, I got to do this. Oh my God, I'm not relaxed right now, so I'm doing something wrong. What's wrong with me, right? No, you have to be able to cultivate a passive attitude where you're not worrying about how well you're performing. In this sort of what he calls a let it happen attitude. And that takes practice. And that's why we work with meditation or relaxation and yoga, because every time we get into our yoga space, we're working on sort of this passive, let it happen attitude. So being really gentle with yourself. I think that is just the fundamental piece. So if you're fighting internally with yourself, then that's going to be really hard to bring forth the relaxation response. And then a comfortable position. You have to avoid undue muscle tension, and when you're in pain, sometimes that's really difficult in certain postures. Sometimes sitting alone is painful or lying down is painful. But you can't be so comfortable that you need to, that you think you might fall asleep. So it's really finding that balance, and that's where I think restorative yoga is really great, because you get to use a lot of pillows and props to support your body and reduce muscle tension. And that's how I first learned how to do the relaxation response. And I think that's a really powerful tool. So what I wanted to do today is maybe just go over one of my favorite ways based in yoga to do this. And I'm aware that we might not be all in a quiet environment or in the most comfortable position at the moment, but I'm going to give you a moment to get that ready, even if it's not the most perfect thing, okay? And what we're going to work on is something called Brahmari breath, or it's like a bumblebee breathing. All right, so we're going to work on slowing down our breathing rate while focusing on sound. And so it's just going to be sound we're making. All right, so let's have everyone get ready. All right, I'm gonna open up so we can see. There we go. So, all right, last thing, this will be brief. All right, so if you're comfortable, looks like people are settling in, okay? And so we're gonna start with progressive muscle relaxation. And so that's where we're gonna tense our muscles and then relax them. So this has been shown in research to be helpful. So you can close your eyes or keep them softly open. And you're gonna just start to what we call a body scan. So you're just gonna kind of scan your body from top to bottom. And we're gonna tense the muscles around the eyes and the forehead and the cheeks. So you're just gonna add that tension and then let it go. So like you're squeezing the eyes and the mouth and then letting it soften. And then you're gonna squeeze the shoulders and then let it soften. You're gonna squeeze your fists and then let those soften. You're gonna squeeze your legs and your glute muscles and then you're gonna let them relax. Squeeze your toes and then let it go. And now your body knows the difference between tension and stress and a little bit of a letting go, let it happen pattern. Okay? And then you want to start to listen into the breath. We're going to use that as our mental focus today. So we had a mental device that we needed, and we're going to use our breath as that mental device to shift our mind. So the breath is yours, it's always with you, and it's our link to our inner relaxation response. All right, so you're going to breathe out nice and slow, and then breathing in. Exhale for the count of 4, 3, 4. Inhale for the count of 4, 3, 2, 1. And out, 3, 2, 1. Continue with that pattern. Letting your breath feel nice and smooth. You're just guiding it to be soft, like waves rolling from the ocean onto the beach and rolling back out. Very soft, very gentle. Now we're going to add in Brahmari breath. So on the exhale, all you're going to do is hum. So that's going to be a deep humming sound that resonates in the chest and in your head. So it's going to sound like this. And then you inhale. And we're going to do that a couple times. And I'm tempted to have people unmute so we have this like symphony of sound. If you'd like, you can. If it interrupts your relaxation, don't worry. Okay? So we're going to breathe in. And as we breathe out, we're going to hum. And just as you're ready, you're going to hum. And we're just going to go at our own paces here. These next two begin to soften the sound, so we're going to transition towards silence. And then if you want, begin to open your eyes, come back, and just observe your body, observe your feeling tone that the practice left you with, without judgment, right? So that's the key. If you induced a little relaxation response, good job. If you didn't yet, that's okay. This was just a practice. All right, guys. Thank you for participating in the humming. It's so beautiful. It's one of my favorite practices in a yoga class, when you get to have sort of those resonant tones and to feel the connection to the collective. Because in reality, we're all there in this together. We're all on some level feeling stress or pain or have at some point. And when we bring our voices together for the purpose of relaxation and restoration, it's just absolutely one of my favorite things. So thank you for those of you who contributed your voices. It was very soothing and lovely. So I'm going to go ahead and stop my screen share here, and hopefully we can have you ask some questions, if you have any, in the chat box below, and I'll try to get to some. We are 10 after 10, so whoever can still stay on, I'll be answering some questions. And then just to reiterate, you, because you've attended, you are going to get an email from marketing about a free consultation to come in. And you're going to get an email with 10 burning questions, which is just the most common questions I usually get. And I wrote them out for you, so you have some additional tools. And I think there's going to be a video posted, so you can access that. And then, there'll be another follow-up so that, if you have any other concerns and questions, we'll be in contact, okay? I think the only other thing is, let us know if you liked this. We'll be doing more. And if you really liked the yoga, let us know, because maybe we'll start to open up a little bit more of a regular yoga practice based on time and interest, okay? All right, so let's see here. I'm going to look at the chat here. The slides will be available. I think so. Are the slides going to be available? Marketing? Okay, yes. The slides can be available. Do I have a yoga DVD or online video? So that's something I've done a little bit of yoga videos with Body Central. They've been posted. You can go ahead and keep following Body Central. We'll probably do some more. I'd like to do more regular videos so people have access to those. So just stay tuned, okay? And then I just see some people wanting to do some yoga, and and it's just great. Thanks everyone who came. It's good to see some familiar faces. And then someone's asking a specific question about cat-cow pose and if it's recommended. I love cat-cow pose. It's a great place to start because it keeps your spine in neutral without any gravity, like standing, and it helps you normalize some of your motion in the back, and it's very neutral for the hips, so most people don't get any hip pain with that. So it's a great one. I do that all the time. We did record it, so you can watch it again. I know I went through some things kind of fast, so it will be posted on YouTube, probably Monday. Liz, good to see you. And then, and then I'm just glad people learned. And then, so if people are interested in video instruction, I'm in the works on that, so stay tuned. I'm at the Cortero location, so that's on the northwest side, and so you'll get that in the email as well, okay? So we do have clinics all around, and we do have pelvic floor physical therapists at all of our locations, but I'm up here in the northwest, okay? And then some other questions here are, if the pelvic floor muscles are too tight, are these strengthening exercises beneficial or detrimental? It's a great question. So this is best addressed personally with, an assessment of your background and things like that. But generally speaking, if they're too tight, we have to do a couple other interventions before you start strengthening. But I think just building in some awareness early on about the pelvic floor is never harmful. But yeah, you'd want to first address the stiffness and the tightness, and then work on letting those muscles be strong again in the right length. Great question. All right, so good. Yeah, I'm glad some people are enjoying it and are interested in some regular classes. Let's see. So sometimes people do get back pain that makes their legs feel heavy and tired. And that can be, so it can be because of inactivity, and those muscles are no longer good at doing more endurance work. So you can still strengthen. You just have to be really mindful about what's going on in the back and how to moderate the activity or change the activity so it honors what's going on in the back and helps you get your hips and legs strong again. Okay. Oh, thanks, Margaret. And then, so there's an insurance question with Body Central, and yes, we do accept most insurances, and our billing department and our front desk will guide you through that. They're really great there. Let's see. And then we have some running questions. So I have regular issues with my legs. I'm not sure if that means you're already doing yoga or if you need to continue to or start doing yoga to help with that. With running, we do running analysis here, and we know how to test some certain key muscle groups that help improve running stability. So, I'd say to Desiree that I think you would benefit from just doing a consult, because running is there's so many different things that go on. So, and you can message a little bit more detail if you have any further questions, but I think that would be good for kind of a one-on-one. A couple questions about insurance and yoga. Insurance does not pay for yoga. I think sometimes there's depending on the insurance, they give you some incentives if you do some self-care, but that wouldn't go through, we wouldn't bill insurance for that. And then here's a good question. So can running harm prolapse, and what's recommended? So running is a high impact activity, and so if there is prolapse to a strong degree, because we grade it 1 through 4, then yes, that can be a problem and needs to be addressed. And so I would say that, I have had people come in with prolapse and want to get back to running, and we just work through the series. We work through what's going on, help identify the issues, and if it's something muscle related, we can help. And I mentioned that there's some hip muscles that we work on that help improve pelvic muscle strength. So it's usually a whole body approach there. So if it's like a grade 1, running is all right. If it starts to be a little bit more severe, then we have to take some modifications here and there. And so it's a good question. I've often done a lot of return to run programs for people with pelvic floor symptoms. Okay, those were great questions, you guys. I think I was able to answer most of them, I believe. Again, you'll have a chance to do some consults if you have any more personal or further questions. All right, and then I'm just going to turn it over to marketing if they have anything to say, or we will just, yeah, thanks, Michelle. So yeah, I think that if marketing would like to say anything.
Yeah, hi guys. So just like Elena said, I will be sending out an email on Monday about consults, and I'll attach her PowerPoint and the 10 burning questions. So just look out for that, and I hope you guys enjoy. We'll be doing a workshop once a month, but it will be different topics. So I'll keep you guys updated with all that. But yeah.
Okay. Happy Saturday. Bye, everybody. Namaste.
Thank you.